And it goes a little something like...
Hi, good day. I'm student nurse Kristel, and so for today's video, we are going to do the Community Health Nursing or CHN bag technique. Before we start, what are the purposes of bag technique? First is to minimize or to prevent the spread of infection. Secondly is to work efficiently and rapidly during techniques as a means to relate thought and energy so that we can work with the family more effective, thus saving time and effort. And then assuming that this is my CHN bag, this is just an improvised or alternative only. Okay? And then the first thing that we need to do upon arriving at the client's home or house is to greet them or introduce yourself, of course, and then use also two identifiers to identify the family. And then after doing this, we can now place our bag on the table or in any flat surface lined with paper lining or plastic cover like this. Okay? This is to protect our bag from any contamination. Now we can now open it, and then we are going to have the clean side out, and then the folded part is touched by the table. Okay? And then I will going to line this also with Manila paper or just clean paper, as well as the plastic cover. The clean side is out. Okay? And then the folded part is touched by the table. Okay? And then assuming also that the table is fully covered with the paper or plastic lining. And now we are going to put the bag on the table and then put the bag's handle or strap beneath the bag, like here. Okay? And then after placing our bag, we are going to ask our patient if they have sink and water for us to wash our hands later. And if they don't, we can now ask them for basin with water. And then place this outside the work area. And then after it, open our bag. Okay, open our bag. And then take the linen or plastic lining and spread over work area. The clean side is out also, and this is for non-contaminated work area. Now we can take out the hand towels with soap dish and our apron. And then we can now place them at one corner of the work area, and now we can do the hand washing. Don't forget to wipe and dry with towel and leave the plastic wrappers of the towel in a soap dish in the bag. Next, we can now put our apron right side must be out, okay? And then the apron protect the nurse's uniform. Assume that this is the nurse's apron. And then slide the head into the next strap and then neatly tie the strap at the back, okay? After putting our apron, we can now put out all the things that we need the most, and these things are specific from the case of our patient. If we are going to measure the fundic height of the pregnant women of our patient, we are going to put out the measuring tape. If we are going to do the perineal care, we are going to put out the wash clothes, soap, basin with warm water, protective barriers, and blanket. But this time, I will going to put out the kidney basin and then the thermometer. We have also the cotton balls, separate container, and then the waste paper bag or plastic bag. And then don't forget to place them on one corner of the working area to make them readily accessible. And then place the waste paper bag or plastic bag outside of working area to prevent the contamination of clean area. And then next, we can now close our bag to give comfort and security to maintain our personal hygiene and hasten recovery. We can now proceed to the specific nursing care or treatment to our patient. Top to bottom, and then the right side, top to bottom again, and then the middle,
section, top to bottom. And then, retract the labia majora, top to bottom. Okay.
After completing nursing care or treatment, we can now clean and alcoholize the things that we have used, and this is to protect us and prevent the spread of infections to others. Okay? We have the tissue here, or the wet wipes, and then give it some alcohol. Okay. And then discard this to the paper bag. Okay, and the next. Okay, and then do the hand hygiene again, assuming that I already washed my hands. And then after washing your hands, open now your bag and put all the equipments that you have used in their proper places. Okay. Okay. And then remove the apron by folding away from the body with soiled side folded inwards and the clean side is out. Okay. After you folded out your apron, you can now place it in your bag. Okay. And then I will going to get this first. And then, don't forget also to remove or to fold out this paper and plastic linen. But before, you can now get your bag and put it on your shoulder before folding it or removing the paper linen or plastic linen. And then you can now fold it. Okay, as well as the plastic. Okay, and now you can now put it on your bag, and then you can now close your bag. And then don't forget to sanitize or alcoholize your hands. After closing your bag, we can now record all the procedures or findings that we have done in our patient. Okay? And then don't forget also to make post-visit conference on matters relevant to healthcare and taking anecdotal notes preparatory to our final reporting, of course, and to be used as reference for our future visits. And then lastly, don't forget to make appointment for the next visit to our patient. It's either home or clinic, and then take note of the time, date, and the purpose of the visit. And this will be for our next follow-up care. So, thank you!